Hey everyone, and welcome back to the channel. I was scrolling online the other day, just like many of you probably do, and I saw it again. That golden-hued drink, promising everything from weight loss to glowing skin, apple cider vinegar. It feels like every wellness influencer and health guru is sipping on this stuff, and it makes you wonder, right? Is this the magic potion we've all been looking for, or are we just drinking, well, acid? Let's get into it and separate the facts from the hype. So what's the big deal with apple cider vinegar? The buzz is huge. People claim it helps with weight management, improves digestion, and even helps control blood sugar. And there's a kernel of truth to some of this. The main active component in ACV is acetic acid. Some interesting studies have looked into its effects. For instance, a 2018 study published in the Journal of Functional Foods involving participants on a reduced-calorie diet found that the group consuming apple cider vinegar daily saw a more significant reduction in body weight, BMI and hip circumference compared to the group that didn't. The theory is that acetic acid might help you feel fuller for longer, so you naturally eat a bit less. Then there's the blood sugar angle, which is probably one of the most researched areas. The American Diabetes Association published research in their journal, Diabetes Care, suggesting that consuming vinegar at bedtime could help moderate waking glucose levels in people with type 2 diabetes. It seems acetic acid can have a modest anti-glycemic effect, meaning it helps prevent sharp spikes in your blood sugar after a starchy meal. It's not a replacement for medication or a healthy diet, but it's a fascinating finding that researchers are still exploring. But here's where we need to pump the brakes and have a real conversation. We're talking about an acid. Dr. Sarah Brewer, a medical director at HealthSpan, often reminds people that while ACV has benefits, its acidity is a major concern. Drinking it straight or in large quantities can be seriously harmful. Think about it. Pouring a strong acid directly onto your tooth enamel is a recipe for erosion. Dentists see this all the time. The acid wears away the protective layer of your teeth, making them sensitive, weak, and prone to cavities. According to the American Dental Association, acidic foods and drinks are a leading cause of tooth enamel erosion, and ACV is definitely on that list. And it's not just your teeth. That same acidity can irritate the delicate lining of your throat and esophagus, especially if you're prone to acid reflux or heartburn. For some people, instead of helping digestion, it can actually make things much worse, causing discomfort and burning sensations. There's even a documented case in the medical journal Case Reports in Gastroenterology, where a woman experienced long-term throat burns from an ACV tablet getting stuck. That's a pretty scary thought. Another risk that doesn't get talked about enough is its potential effect on potassium levels. The University of Maryland Medical Center has noted that high doses of apple cider vinegar over a long period could lead to low potassium levels, which is a condition known as hypokalemia. This is especially risky for people taking certain medications like diuretics or insulin, which can also lower potassium. Low potassium can affect your muscle and nerve function, and in severe cases can be dangerous for your heart. So what's the verdict? Is it a health hero or a hazardous trend? The truth, as it often is, lies somewhere in the middle. Apple cider vinegar isn't a magical cure-all, but it's not pure poison either, if you use it correctly. If you're curious and want to try it, the key is safety and moderation. Here's the expert-approved safe way to do it. First and foremost, always dilute it. Never drink it straight from the bottle. A safe and commonly recommended ratio is to mix 1 to 2 tablespoons of apple cider vinegar in a large 8-ounce glass of water. And when you drink it, consider using a straw. This helps the liquid bypass your teeth, minimizing that direct acidic contact and protecting your precious enamel. Timing matters too. It's best to have it with a meal, not on an empty stomach. This can help buffer the acid and reduce the risk of digestive irritation. And after you've finished your drink, rinse your mouth with plain water. Don't brush your teeth immediately, though. Your enamel is softened by the acid, and brushing right away can scrub it away. Wait at least 30 minutes. Also, be a smart shopper. Look for raw, unfiltered, and organic apple cider vinegar. This kind will be cloudy and contain what's called the mother, which is a strand-like substance made of enzymes, proteins, and beneficial bacteria. This is where many believe the real health benefits are concentrated. And finally, the most important piece of advice: talk to your doctor. This is absolutely critical if you have any pre-existing health conditions, like diabetes or kidney issues, or if you're taking any medications. A healthcare professional can give you personalized advice and make sure that adding ACV to your routine is a safe choice for you. Ultimately, apple cider vinegar can be a small supportive part of a larger healthy lifestyle that includes a balanced diet, regular exercise, and good sleep. It's a tool, not a solution. So let's be smart about it, stay informed, and prioritize our health and safety above any trend. Thank you so much for hanging out with me today and diving into this topic. I hope this cleared things up and gave you the confidence to make the right choice for your body. If you found this video helpful, a little thumbs up would mean the world to me. And hey, if you want to keep learning and exploring health topics together, make sure to hit that subscribe button. Stay safe, stay curious, and I'll see you in the next video.